I'm Dr. Jeremy Campbell. I'm a doctor of physical therapy and U.S. Marine Corps veteran. I want to talk about foot alignment and share the best tools I found to bring feet that are out of alignment back to a neutral position and a healthy gait. Our feet are the foundation for the rest of our body, and if the alignment in our feet is off, then the rest of the body can suffer. I would estimate that roughly 75% of my patients overpronate, about 15% oversupinate, and the other 10% have a nice, straight, neutral alignment. These are generally younger, healthy, fit, and athletic people. Most people I see are overpronated. It's extremely common, and there can be variability in the issues caused from this type of poor foot alignment, where the arches and ankles drop and fall inward. I'll see them with plantar fasciitis, Achilles tendonitis, and heel pain. They get pain on the inside of the knee, hip pain, lower back pain, and sciatica, among other issues. One of the things I do is check to see if my clients are taking care of their feet and wearing good shoes with support. I've looked up a lot of studies, and first off, it is clear that arch supports are very helpful for flat, overpronated feet. Secondly, the studies show that prefabricated orthotics are just as effective as the custom ones, which is great because over-the-counter orthotics usually cost just $20 to $60 instead of the $300 to $500 for custom ones. There are a handful of different kinds of pre-manufactured supports out there, so you do need to make sure you get the right style for your foot type and for the shoes you wear. I've noticed that some people really don't like to compromise on their shoe style. They only like to wear Converse or other specific brand name shoes, and there's no convincing them to wear an athletic style shoe that will fit a full orthotic. It's understandable, but also in the summertime, people like to wear sandals, and it's rare to find a sandal with support. For these types of shoes and sandals that don't have a removable liner, Sole Insole makes these smaller gel orthotics that I can just stick down to add arch support, and they fit easily into any of these types of shoes to stop overpronation. I occasionally find people that just can't tolerate the feeling of arch support. Usually they tell me they were born with flat feet. I know that I still need to help tilt them to a neutral position to address their pain. So, for this foot type, I'll use a heel wedge with a thicker edge placed along the inner edge of the shoe to provide posting and tilt the foot. The cool thing about these heel wedges is that they can be used for the opposite foot type as well, an oversupinator. I would just place it so that the thicker edge is on the outside edge of the shoe to stop the foot from rolling outward and help prevent ankle sprains and help prevent the shoes from wearing out unevenly. If you mostly wear higher quality athletic shoes, these shoes will usually come with a removable liner like this, and you'll have space for a full-length orthotic just like this. With the full-length orthotic, you'll also get some nice cushioning in addition to the support that will bring that fallen arch up to a neutral position. These ones I really like because they come with some extra gel supports that you can add on for extra posting or support for an overpronated foot or an oversupinated foot. One more type of alignment issue I often see is a limb length discrepancy. A person can be born with one leg shorter, but more often I see it happening after hip surgeries, knee surgeries, or other traumas. For leg length discrepancies, I can easily balance the heel height out with some heel lifts like this. Now, you never want to add a heel lift that is equal to the amount of the discrepancy, because when you've had a difference in leg length for an extended amount of time, the body will have already compensated for this by lengthening some tendons and ligaments and tightening others. We don't want to throw you off in the opposite directions, so I always add about a half of the difference. For example, if you have a 1-inch leg length discrepancy, I would add a 1/2-inch thick heel lift. These heel lifts from Sole Insole are great because they can be stacked to the height that you need, and they're adhesive on the bottom. So there you have it. These are my favorite solutions to balance a body that's out of alignment starting from the feet, whether you overpronate, supinate, or if you have a limb length discrepancy. I'll add links below to the products that I've shared. Again, I'm Dr. Jeremy Campbell, and I hope this video can help you to live a more active life that is free of pain and discomfort.